used a modified Delphi consensus method and assembled a group of physicians in anesthesiology, internal medicine, as well as psychiatry, and also had input from pharmacists. And essentially tried to identify every dietary supplement, herbal medicine, and so on that is available currently. So hi, I'm Ken Cummings. I'm an anesthesiologist at Cleveland Clinic, and I'm here to describe our consensus statement from the Society for Perioperative Assessment and Quality Improvement, or SPACI, on the preoperative management of patients taking dietary supplements. So the title of the article is Preoperative Management of Surgical Patients Using Dietary Supplements, the Society for Perioperative Assessment and Quality Improvement Consensus Statement. And it'll be appearing in the Mayo Clinic Proceedings May 2021 issue. There are previous reviews looking at this, but there's been an explosion of these agents available, and about 30% of people are on them in the US, and some new evidence. And the society believes that having a single reference available for perioperative clinicians would be quite valuable. So I was fortunate enough to be asked to lead this group, and had an excellent group of co-authors who volunteered a lot of time and effort in this project. We sought the most recent literature available, and be that primary or secondary literature, and had a series of consensus meetings to evaluate the literature and determine what the recommendation is, whether it should be continued perioperatively, whether it should be held preoperatively, if so, for how long, and what the perioperative concerns were. And this is important, like I said, because there are a huge number of supplements available, and patients implicitly assume that these are safe because they're, in quotes, natural. We know that these are real pharmacologic agents with real activity and real drug interactions, and so as perioperative clinicians, it's important to know how these impact patient care. And we identified 83 particular supplements, many of which are commonly known, some are very rarely used. And sort of the take-home point of the statement is that blanket policies actually aren't particularly helpful. Most institutions would say stop all supplements for 2 weeks. For example, at my institution, that was what we were doing. And it turns out that some of these agents are quite benign and can probably be continued. Some of them may actually even be helpful perioperatively. For example, lavender, chamomile extract, phenylalanine, and so on. And some of them are certainly harmful. And this provides an opportunity for not just avoiding them perioperatively, but perhaps getting patients to stop taking things that might pose longer-term health risks, like taking ephedra, kratom, things like that. So in that regard, I think we've helped perioperative clinicians, but also are serving to improve patient care long-term.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.